Well, federal workers are experiencing layoffs at agencies across the country right now. Last Friday, Elon Musk sent out a second round of emails demanding federal workers to disclose their recent accomplishments or risk being fired. With all of the job uncertainty for federal workers, many are finding themselves worried about what's next. Joining us now to talk about the mental health impact this is having on people is Dr. Varma, a psychiatrist and author of the book Practical Optimism. Doc, good to have you with us. How are you?
Thank you. Nice to see you.
So can you explain the psychological impact that sudden job loss can have on people when they know that their jobs, one day may be there and the next day may not at the federal level?
Sudden job loss can potentially be very devastating. As much as we think that we're prepared for it, we're always hoping in some ways that it's not going to be us. And it can lead to anything from insomnia to restlessness, fatigue, anxiety, depression. A lot of times people manifest problems mentally in their body, so unexplained headaches all of a sudden or GI problems. So it can really take a mental health toll. It can be very devastating.
This is something that I've been saying for decades. We're all on one-day contracts when it comes to employment. It seems that many federal workers, though, they're dealing with that sense of unpredictability right now. And how does that contribute to the mental health crisis that exists out there with people who are not so sure about their jobs?
Exactly. That's such a great point that a lot of people already may at baseline be struggling with financial uncertainty, with feelings of past traumas, with their baseline anxiety or depression. And there's a lot of sense of identity that comes from our job. Like a lot of the people who are working in these jobs have had these jobs for many, many years. It might have been their first job right after school or training, and they imagine themselves retiring at these jobs. So it can be very, very hard. And I think it's so important that everybody be prepared. I hate to say that, but it's like, just like you said, the one-day contracts, and anticipation is such an important step for preparation. So if you're thinking in the back of your mind that there is at all, even a 5% possibility, I would say start having these difficult conversations with loved ones and say, what are we going to do about this? Because a lot of times our worries are what we call unproductive worries, where our wheels are spinning in the mud, but we don't actually have a plan. And so I would say try to translate that unproductive worry into something productive and say, how am I going to plan? So changing that anticipation into preparation.
I think you would agree. Normally, you try to tell people, let's not worry about things that haven't happened yet. You're only going to make things worse. But with something like this, it is very difficult when you've got tens of thousands of workers who are, whether you think the federal government is right or wrong with decreasing the workforce in the federal government, this is affecting people as it trickles down. You can't make that argument that it's not the case. What can organizations or leaders, though, do to mitigate the mental health risks that are associated with these mass federal layoffs?
So having conversations that are open, transparent, and starting the communication very early on to say, listen, we don't know what's coming next, but we want to just make you aware of whatever benefits are accessible to you. So that could be anything in the form of healthcare. I know that anytime any of my patients are about to lose their job, they're worried. They're like, how am I going to continue to see all my doctors? So something like COBRA or any kind of benefit that extends your health insurance beyond the life of when you're leaving your job. Also, sort of career transition or career counseling can be extremely beneficial, and having conversations of how can we help beef up your resume? What do you need from me? Do you need a letter of recommendation? Employers can say if they feel comfortable giving it, but anything that you can do to make your employee feel supported. And then as the employee, I would say whatever you can do to take care of your health. Do you need a therapist, lined up? Because I think even a few sessions can be very beneficial through an employee assistance program. So whatever benefits you have, if you wanted to see the doctor, get your checkups now, right? Like utilize anything that is at your service, and also take care of your health in terms of maintaining a routine. If you do lose your job, to try to make finding another job, if you need to, your next job. So a lot of times people get demoralized and they're hopeless and they don't get out of bed on time. Exercising, keeping in contact, getting phone numbers and emails, getting on a group chat with other employees to say, hey, can we share resources? Social support is going to be very key during any major transition in your life.
Especially when you really don't know, because it's not as though if you're an underperforming employee or somebody who's new, aside from the probationary employees, it's so arbitrary who's being fired and who's being retained. So it's almost like everything you've described there, everybody kind of has to do it over these next couple of months until you see exactly when these layoffs are kind of subsided. All right, Dr. Varma, thank you very much. We appreciate it. Psychiatrist and author of the book Practical Optimism. As you can see over her shoulder there. Thank you, Doc. Good to see you. To read more about the mass layoffs impacting federal employees, you can go go to cbsnewyork.com. In other news now, double parked cars